African countries are set to receive far fewer COVID-19 vaccine doses than initially expected from Covax. The organization was established to ensure more equitable distribution of the jabs. The World Health Organization, which helped set up Covax, says that there is a deficit of 100 million doses. And this means that Covax will miss the December target to distribute 520 million doses. To get a better sense of what this means for Africa's vaccination rollout program, we're now joined by the Director of KwaZulu-Natal Research, Innovation and Sequencing Platform at the University of KwaZulu-Natal, Professor Tulio de Oliveira. Thank you so much indeed for joining us and welcome to the program.
Good evening, Peter, and good evening to all your viewers.
All right, I'm not quite sure where to start, but let's start with the news that we have, is that we're not going to get as many vaccines as we had hoped. What does that mean for a vaccination program? Because we're all trying to get to herd immunity, I believe.
Okay, so thank you. Yeah. So fortunately, the lack of vaccines is not affecting South Africa. So South Africa, decided not only to rely on Covax, but to procure the vaccine direct from the companies, for example, from the Pfizer, from the Johnson & Johnson, and at the moment they are evaluating a number of other vaccines. But the very sad reality is that many of the other African countries, which are not well-resourced as South Africa, they are having a very big deficit. Yeah, and I note, Peter, that you highlighted that 100 million less doses will arrive in the African continent this year. But the reality is that they are already behind schedule. So in reality, we are talking about close to 500 million doses. To be more specific, is 473 million doses that should have been delivered in Africa this year and was not. Yeah. The problem is not just the number, but it's just the timing of the vaccine availability, because one thing is to have vaccines before waves hit you, and then after, if you have only after, then it translates in a lot of unnecessary and very sad deaths.
All right, so there will be the deaths and the hospitalizations as a result of not being vaccinated ahead of a wave. But I'm also told that there's complications that happen when you have people not being vaccinated between waves because of mutations.
Yes, exactly, Peter. So one thing just to realize, like in the first thing in relationship to the deaths and hospitalization, in some of the less resourced African countries, is a true tragedy. People end up dying like in the corridors, or even at home because the hospitals do not have enough healthcare workers and intensive care units. Another big problem of not having vaccines, it was highlighted in a big Pan-African analysis that we did with 122 different groups in Africa, that just show that like the potential of more variants to emerge. And if you imagine people like in South Africa and Africa, we had enough of these variants. The last thing that we want is another variant emerging. But what we see and what we really believe as the scientific community is the lack of vaccinations in the African continent potentially will increase the number of new variants that will come, and that can cause not only waves, but also more variants that are either more transmissible or that decrease the effect of vaccines.
So it looks as if whilst Africa probably was spared the first, maybe even the second wave compared to the rest of the world, that it looks like as the waves continue, we'll probably feel the brunt of it more than the other countries.
Yeah, and apology for correcting you again, Peter. But the second wave was very extreme. Was already very extreme in countries like Mozambique, in Zimbabwe, in Malawi, and the third wave was very, very extreme in Botswana. For example, Botswana unfortunately has some of the highest number of infections per population at the world there. So the waves have been very, very extreme already, both the second and the third. Yeah. And if you're not careful, especially if not only the lack of vaccines, which is a lot caused by rich countries hoarding vaccines. Many of you have heard about this trying to give a booster, which there is no scientific evidence that a booster is needed for people that already had 2 vaccine doses in the developed world. That's causing a big demand on vaccines and make very difficult to get vaccines in the African continent. And unfortunately, if we don't solve that very quick, which both myself, but many of our scientific colleagues and the director of the World Health Organization, the director of the Africa CDC is very vocal, we have to start protecting the whole world through vaccination so we can protect the whole world to avoid new variants to emerge.
All right, so if we don't get these vaccines, how many waves might we see?
We don't know. We have, and for a scientist also have to be honest, when we know and we don't know. The reality is that we do not know. Yeah, we as the scientific community, we never expected either a second or third wave. So this virus keeps surprising us quite a lot, and that's why it's so important to continue this very detailed genomic surveillance network, which fortunately South Africa is one of the leaders in the world on that. So not only to detect when waves start, but if new variants come, and to define what's the best vaccination to that. But at the moment, some of my colleagues and some of my they are predicting a 4th wave to start in December. But the reality is that we don't know. We really hope that what we move through is that even if waves of infections come, through high vaccination, that do not translate in a wave of deaths.
So I look at television and I see football stadiums full in the United Kingdom, in America, and they've gotten so much further in terms of getting these vaccines. But is that a false sense of security, given that there's a whole continent, Africa, that isn't vaccinated? Or is there a way to make sure that, if you're in England, you're not going to be affected by Africa, or do they remain vulnerable?
Yeah. The first thing we are 18, 19 months into this pandemic. Yeah, people is really tired. Yeah, and we as scientists, we are quite exhausted. Yeah. And people want to go back to normal. So I honestly find quite positive the increased vaccination to go back to normal life and stimulate economic activity. And I was very positive this week when I see our captain of the Springboks, Sia Kolise, highlighting that he really wants to see full stadiums, but also highlighting his personal experience that by being vaccinated, he got infected with COVID, and within days he could go back to very high intensity sport with almost no developing of symptoms. So it is something that we really want as a country to go back to normal life. Yeah, and I honestly think that may be a easy thing to do, just like increase vaccination, and then we can stimulate the economy. We can go back to full stadiums. We can go back to festivals. I think people in South Africa love dancing and they love music. Yeah. And that's what we want to do. If this provide a false sense of security, yeah, yes and no. It provides a false sense of security because transmissions can still happen, But if it doesn't translate in debt and doesn't overwhelm the health system, I think that in reality is worth it. We need to stimulate our economy, and we need to go back to normal life.
What about South Africa? You said at the beginning that we are likely to purchase our vaccines directly from the suppliers, so we may not be as affected as other African countries. What does that mean in terms of movement of people? Because South Africa is going to open its borders more and more as time passes, but the vaccinations are not going to happen at the same pace. Will we see infections being brought into the country?
Okay, so we know very well that this virus travels with people. That's very characteristic of respiratory virus. Yeah. And one thing that South Africa has done well, and I hope they continue to do even better, is this process that if you are inside South Africa, you can get a vaccination. Yeah, if you are residents, if you are a tourist, or if you are even a illegal migrant. Yeah. And why is that the right thing? Because it's not just about protecting the person that is in South Africa, but both stimulating the economy, but more important, protecting South African citizens. Yeah. So other countries in Africa, for example, Zimbabwe, many people do not know, but they have a vaccination as high, if not higher than South Africa. They also managed to sort vaccines, and Botswana is also doing very well. Namibia is catching up, yeah, and that will be good if we can get a small like kind of protection ring around the SADC area, yeah, or Southern Africa on vaccines, and that's where it is very important to South Africa keep the vaccination program, especially to anyone that is in the country, in spite of the nationality of legal status.
At what level do you think we need to get before you can start to feel some measure of comfort, maybe?
I think that South Africa is going back quite quick to relatively comfort or at least mobility and economic activity. The important thing to always remember is not the percentage of the whole population that is vaccinated, but especially the percentage of the whole of the population that's likely to develop disease and symptoms. So, for example, what we really need to focus is to increase the percentage of vaccination in the over 60s, the over 50s, the over 45s, and people with comorbidity, because these are people that, in case they are infected, and many of your viewers may be aware this week of these results that come from some of our big hospitals in South Africa, showing that over 95% of people that are in ICUs in South Africa, it's non-vaccinated. And the main objective of a vaccine is to protect the development of disease and mortality, but also to protect the health system. So if we can increase it to 70, 80% vaccination on people with comorbidities and older age, we will go back to quite relatively normality. And we all need that. I think that this pandemic has hanged far too much, and we also have a big economic problem, and we need to generate employment and get the country back to move forward. Yeah.
Professor de Oliveira, thank you so much indeed for joining us, and let's hope that those people who are taking their time to get vaccinated will heed the message and go and get vaccinated. Thanks for joining us.
Thank you.